Okay, so hi everyone again. If you just joined, since I said hi the last time, thank you for joining us this morning. My name is Jill D'Amico. I work here at the South Brunswick Public Library, and we are so happy to have this presentation going on today. This is a really important topic. It's definitely hard to keep up with everything, but luckily we have somebody here who can help us understand a little bit more and get your questions answered. So I am very pleased to introduce Gabrielle Escribano. I'm sorry, Gabrielle. I was like, I'm going to get that right. She's a certified assister counselor from New Jersey Citizens Action, a wonderful organization in New Jersey. If you don't know about it, look into them. She has years of experience working in the nonprofit and social services sector and is a passionate advocate for educating the public about the available assistance programs available to them. So I'm going to hand it over to Gabrielle. I'll be here. She'll give you a good introduction, but if you have any questions, you can put them in the chat or the Q&A and we'll keep up with them. But without taking any more time, I will hand it over to Gabrielle. And thank you so much for being with us.
Thank you so much, Jill. I really appreciate it. And like Jill said, today we're going to be talking about health coverage. New Jersey Citizen Action is actually a pretty great company. If I were you, definitely go online and see all the services that they have because the resources are just so much. Right? So typically I do answer all questions at the end. If you really need me to answer something right away, just raise your hand and I'll definitely do my best to see it and answer it right away. I suggest that you at least type your question in the chat, put it in there so like that you do not forget your answer. All right. So let me just share my screen and we can get started. All right. So beautiful. I see some participants are coming in now. So if you missed it, my name is Gabrielle Escribano. I do work for New Jersey Citizen Action. I am a certified assistant counselor. And today we're going to be discussing the Affordable Care Act, health coverage. All right. So the first thing is acknowledgement. Of course, the substance and findings of this work are dedicated to the public, and the author and publisher are solely responsible for the accuracy of the statements and interpretations contained in this publication. So this is something that I had to put in there. The federal, state, or local government are not held liable for the words that I have to say. All right, so who is New Jersey Citizen Action Education Fund? We're a statewide grassroots organization, fights for economic and social justice. Follow us on Facebook, follow us on Instagram, and you'll see everything that we have fought for and we are still continuing to change in the legislation. We use a combination of policy work to empower low and moderate income people through research, education, and training. So again, do not just not go to obtain resources because you think you're not eligible. There's all different types of resources and they're free resources. So that includes healthcare enrollment assistance, tax preparation, financial coaching, first-time home buyers, counseling, foreclosure, and housing discrimination. So visit us on the web at njcaef.org. And again, you can follow us on Facebook or Instagram. I really like their page. So, what is health insurance? It's a way to pay for the health services that we have. We have our doctor's visits, our hospital visits, prescription fees, lab tests. And overall, it'll help us with the care that we need to prevent illnesses like cancer. It's really important for health insurance to protect you from having to pay the full cost of care. All right. So you may go to a doctor's office, and that first time doctor's office without health insurance can cost you from $100 to $700. But if you obtain health insurance, it could cost you as low as from zero, 25, $50 copay. All right. So it really is like car insurance. You choose a health plan and you pay a premium each month. That's your monthly fee. The plan pays for care, and how much it, it covers depends on your plan. So you're going to take charge of your health. To understand your healthcare, you really need to answer these questions, okay? So before you even speak to a certified assistant like myself, before you even speak to a healthcare representative, you need to answer these questions. Why do you want health insurance? What do you need from your health insurance? And how much can you actually afford? It is really important that you answer those questions for yourself. It's like that when you are shopping for health insurance, you already know what's important to you. Why do I need this health insurance? I need to maintain whatever medical condition I have, or maybe I want to maintain my good health. What are my choices? I want to make sure that laboratory tests are covered and at least 80% is going to be covered. And how? I tell this to everyone. It is so important that you have a monthly budget in mind. So maybe your monthly budget is between $50 and $100. Maybe it's between $30 and $50. Whatever that amount is, make sure you have it ready before you start shopping. So, like that, those numbers aren't overwhelming or underwhelming. All right. So, why is having health insurance so important? Of course, you have your emergencies. So, going to the ER, I'm sure most of you guys know, can cost thousands of dollars. So, without health insurance, that can easily be 7,000, 10,000. It all depends on what you want inside for. So you want to make sure you have that coverage. If you know you go to the hospital frequently, that might be something that you need to take a look at. That ambulance amount, how much is that going to be covered? You might want to check your hospital coverage. That could be what's important to you. You need to see that emergency coverage. All right. So it makes your services more affordable. You could possibly go to the hospital and the service is $10,000, but because you have health insurance, you have to pay 3,000, or it's 500 and you pay 200. The health insurance helps you pay that huge amount um, for the service. So seeing your doctors for basic care can really add up fast. So with the Affordable Care Act, they've made it that preventative services are covered by your health plan for no additional cost to you. What does that mean? That means your yearly physical, no additional cost, your blood screenings, no additional cost, cancer screenings, if you're looking for mental health services, so you really, when you're looking at those health insurances, you want to take a look. What preventative services do they have that's going to cost you nothing? All right. So it is the law to have health and coverage. And you can add this to the why do you have to have health insurance, okay? So in the state of New Jersey, it is the law. And this, in the end, will affect your yearly tax return. So a lot of people like to use your tax return to save it, maybe go on vacation, pay a few bills. If your penalty for not having insurance does not become covered with your tax return, they're going to send you a bill in the IRS. So get health insurance. Okay. Now, the only way that you would be exempted from having to pay this penalty is if you are not required to file taxes. And then you can always just apply for an exempt too. And you can go and apply for an exempt at newjersey.gov/treasury. Okay. Now, I always say just avoid the penalty and maintain some health. Okay. Hope everyone's following along. So, a little clarification of what the Affordable Care Act is. It's supposed to make our health insurance affordable and it's available to a lot more people. The law provides consumers with subsidies such as premium tax credits. So, a premium tax credit is where they will help you with that monthly bill. And what they'll do is they'll credit you that amount for that monthly bill that goes directly to your health insurance. And they'll just take it out of your taxes in the end of the year. Another thing that Affordable Care Act does is it expanded the Medicaid program to cover all adults with the income below of 138% of the federal poverty level. So still not all states have this. This is just New Jersey. But because of COVID-19, beginning in March 2020, the federal poverty line actually dropped. And it made it eligible so that more people can obtain health insurance. So that's really good. So if you're interested in the federal poverty level when it comes to Medicaid, you want to go to NewJerseyFamilyCare.gov. All right, open enrollment this year is from November 1st, 2020 to January 31st, 2021. The Affordable Care Act has helped us require insurance plans to cover people with pre-existing conditions, meaning if they know that I have diabetes, they cannot charge me more for having diabetes. If I got their insurance today, nothing happened, and on February, now I have diabetes, they cannot change the policy. Because of the ACA, it provides free preventative services. It gives young adults more coverage. It ends lifetime and yearly dollar limits on coverage of essential benefits. It holds insurance companies accountable for rate increases. It makes it illegal for health insurance companies to cancel your insurance because you got sick. All right, so I really, really like that. So when can you enroll? Enrollment is usually open for all, and it is always November 1st of the current year. So after January 31st, open enrollment will be November 1st, 2021, and it will roll over till January 31st, 2022. Now, if you have specific life-changing events, then you could be eligible for a special enrollment period. So if you lost your job, someone passed away, someone has been added to your family, you've moved, or you're no longer eligible for family care, you do qualify for special enrollment. So if I've lost my job today, I have up to 60 days to apply through the Get Covered, New Jersey. If I wait longer than 60 days, I'm no longer eligible for the special enrollment period. So it's really important to remember, if any of these things change, just try to get health insurance right after. Don't try to wait too long, okay? So, what can you get? Depends on your income and it depends on your age. New Jersey has the New Jersey's Medicaid program, also called New Jersey Family Care. And it's either free or it's low cost insurance. They cover children from newborn to 19 years old and adults to 64 years old and disabled individuals under the age of 64. All right. Again, you can go on there and you can apply directly for this coverage if you know for this is what you want. You can go to newjerseyfamilycare.org or you can go to Get Covered New Jersey. So you're going to give one of our assistors a call and you would like to get help with your application. So if we put in your application and you do qualify for Medicaid, that's fine. The Get Covered system will automatically send your full application to New Jersey Family Care. Now, if you make too much from New Jersey Family Care, then that's how Get Covered New Jersey will then give you several different options of different health insurances that you could possibly qualify for and the financial help that you also qualify for. Now, there should be no extra cost to have an assister assist you. These are free services. Do not allow anyone to charge you to help you with this service. It is a free service. All right. And if you choose to do this on your own and you prefer not to have an assister, I can assure you, Get Covered New Jersey is super user friendly. You can go right online, nj.gov/Get Covered New Jersey, and it says get started. And that's exactly what you would do. You would get started and you would follow the directions to go through and through. If for some reason you get stumped and you have a question, then that's okay. You still have time to get an assister to help you. Okay. So what's really important is learn what your benefits are and learn how to use them. All right. So now we have our insurance. We get this big packet in the mail usually. And I don't know about you guys, but before this year, I usually tossed mine to the side. And what I learned about that is I wasn't learning what my benefits were. So I was going elsewhere to receive certain benefits when my insurance covered exactly what I was looking for. So you want to make sure that that list of the why, the how, and the what is with you when you're looking at this packet, because these are the things that they're going to be covering and you need to know, right? So on one side, we have what your health plan calls it. And on the other side is what I'm going to explain to you what it is. So the first thing we have is outpatient care. What that means is visits to your doctor's office, same-day surgeries, emergency services, trips to the ER, ambulance transportations. The insurance company calls it inpatient. That means that treatment that you're receiving while you're admitted to the hospital. Let's say that maternity and newborn care is important to you. That's the care women receive during pregnancy and giving birth and after care for mom and baby. There's the pediatric services. The pediatric services is actually the main service that has a dental and vision for children. Okay. Mental health and substance services. Again, that's either inpatient or outpatient treatment, such as counseling, detox, or addiction recovery help. So this is more benefits, prescription drug coverages, that's self-explainable, rehabilitative services. So these are services that you needed to recover your skills after an accident or illness, such as physical therapy. So if physical therapy is important to you, that rehabilitative services is what you need to write down for what's important to you. What do they cover? Great. Check. Habilitative services or devices you need to help function. Um, let's say you need a home health aide to help you. That's very important to you. Make sure that you write that down. Habilitative services. Laboratory services or tests needed to diagnose, treat. So those are your blood tests, your x-rays, your MRIs. If that's important to you, you know that you're going to want to use lots of MRIs this year. That's something you want to take a look at. And of course, our preventative services, which are your physical screenings, immunizations, and or vaccines. Okay. So where do you go for care? Typically, you want to find a doctor that your insurance takes. You can call your health insurance directly to find a doctor, Or you can check out the insurance website to find a doctor. Or let's say you already have a doctor and you've been going to this doctor for the last 10 years. What's really cool about Get Covered system is that you can put that doctor's information in there. And when it gives you the possible health insurances that you are eligible for, it'll let you know if that doctor is in network or out of network um, for those insurances. And we're going to go over what in network and out of network means shortly. Okay? So, a primary care provider, you want to make sure that you find your primary care provider. If you do not choose one, the insurance company will choose one for you. Remember, the insurance company is not going to choose one based on location or anything like that. It really is just picking you up and putting you on your insurance card. So, you want to make sure you do some shopping. Take this serious. Take it as serious as you would take your car insurance. Now, what doctors should you see? This is really important. So, a specialist. If you know that a specialist is important in your, maybe you see a specialist twice a year, 3 times a year. You're having issues with your heart. You want to make sure you're going to a cardiologist because if you end up at a neurologist for the brain, you're still going to pay that copay. They're still going to look at you. You don't want to waste that time, anything like that. Make sure you know what you're going to the doctor for. I suggest that you go to the primary care provider and they can let you know what kind of doctor you need to see. Um, and you typically they would give you a referral, but not every single insurance requires you to have a referral. Most health plans require a written letter from your doctor, but again, not all health insurances do. My health insurance right now does not, but that just means I have to do more Googling when there's something wrong with my elbow and I don't know what doctor to go to. But again, if I go to my primary care and I let her know, hey, my elbow's hurting, whatever the case might be, she would let me know where I should go. And it'll be cool if it's an in-network specialist. Okay. So know who your plan will pay for before you make an appointment anywhere. Make sure your doctor is in network. What that means is that the health insurance and the doctor's office have signed a contract. If they are out of network, the doctors or office of your health plan do not have a contract and could you could be possibly liable for your bill. So you really want to make sure that you read that packet, at least skim through it to see what their in-network and out of network benefits are. All right. All right, so here we have a couple of more health insurance lingo. And I'm sure this is where a lot of us get very confused, at least for myself, I did. So, what is a premium? A premium is the amount you're going to pay monthly. So, if you're thinking about it as car insurance, and car insurance is basically that stable, non-moving amount that happens monthly. All right, your deductible. It's the amount you must pay before the health insurance plan begins to pay for your services. So when you're looking at your health insurance and you're shopping, you'll see your premium amount and you'll see your deductible amount. Let's say your deductible is $1,000. So before your health insurance plan actually really starts kicking in, that first $1,000 would have to be spent. That could be with the $100 you're paying monthly, but those $1,000 for that deductible has to be paid before the health insurance really kicks in. Now, those exceptions will be the preventative cares because the preventative care is free of charge. Co-payment, You go to a doctor's office and you will have a set amount of how much you have to pay for that. So if you go to the doctor's often, if a co-payment is very important for you, if you feel that you never want to spend more than $20 when you go see a doctor, make sure you let your sister know, make sure you know that. So when you're shopping for health insurance, you are also looking at what that co-payment fee will be. And co-insurance. Now, this is a portion of the cost you pay after your deductible. So once you've paid that $1,000 deductible, now your co-insurance starts. And this is the great part. This is when the insurance company will either pay 80% or 70% or whatever your specific plan is. But let's say they're paying 80% and you have to pay 20%. The co-insurance is if it's $100, the insurance company will come and they'll pay their $80 and you will receive a bill for the remaining $20. And that's what the co-insurance is. All right. So a premium paid monthly, deductible is the amount you have to pay before your insurance can really start kicking in for the year. Your co-payment is the amount you pay every time you see a doctor. So there will be a co-payment for a specialist, there will be a co-payment for a doctor. And then your co-insurance is the portion that you would have to pay after your deductible is met, whether that's 20%, 10%, 50%. I'm not sure. It all depends on your specific plan. So remember, okay, you want to get a primary care doctor and you want to go to your primary care physician for non-emergency visits. Okay. When you're going to the emergency room, you really just want to go for emergencies. Remember, the hospital is meant to get you better so that you can walk out of the door to then continue to see a primary care physician to maintain your health. Now, we do provide here free one-on-one remote appointments. We speak Hindi here, English, Spanish, and you can also email us at getcovered@newjerseycitizenonaction.org. These meetings are done by Blue Jeans, where it can be done just like right now in this presentation, where you can see me, you share your screen, and I can just talk you through it. You can also ask me to fill it out for you while you're watching, and I can fill it out and you're watching me and you're talking. And of course, the other option is through phone. Okay, that just requires a little bit more trust. But we are here, we are available to assist you, and we are available Monday through Saturday. All right, so let's take a look at your questions here. Okay, so someone answer the question. Does anyone have any questions? Okay.
This is Jill here. I'm keeping an eye on it too. So I'm looking at the Q&A. Somebody did ask. We will try and get a recording of this out to anyone who signed up. I can send an email. It might take a couple days. But yeah, anything in the chat? Anyone have any questions for Gabrielle?
I hope that everyone will at least see if they're eligible for some sort of assistance. This year, with COVID hitting, New Jersey has really been relaxed on the eligibility, and they have assistance with premium tax credit. They have assistance with at least helping with your monthly bill. Whether it's $10, $20, they are offering these assistance if you are eligible.
I'll pipe in with a question actually, and maybe this will be helpful for somebody else. How many Do you know, is there a set amount of providers in New Jersey in terms of the insurance companies? There are many probably different plans within there, but like who's offering coverage through through Get Covered?
So right now through Get Covered, we have Oscar, we have a Mary Health Silver, Bronze, and Gold plan. And that's the same thing with Oscar too. They do have a silver, bronze, and gold's plan, and we also have Horizon, silver, bronze, and gold plan. All right. Something that I forgot to mention, it's just hitting me now. Just remember, if you want a low premium, your deductible may be higher. And if you want a lower deductible, your premium will be higher. So these are just things to consider. And I really do just want everyone to treat health insurance like your car insurance. I know when I got my car insurance, I read it from front to back. It's really important that you treat it so important like that because it's you, it's your body. We're maintaining ourselves.
Very true. So thank you. Um, okay, so if no one has any other questions, I'm going to take this as a good sign. I want everyone to contact NJCA if you do want to make a appointment with an assister. I will send a follow-up email with the contact information for those direct numbers. Like Gabrielle said, there are people who can help you in specific languages, which is great. And I will, once we have a recording of this, I will share that too. But if there's nothing else, and thank you for the people saying thank you. I want to thank Gabrielle and thank New Jersey Citizen Action Education Fund for providing this. It was really helpful and just good to hear an overview and remember how important this kind of coverage is and how it's available to everyone. And you might learn something you might not even know. You might have thought it was unattainable, but hopefully not.
Well, thank you
Okay.
so much, Jill, and thank you to the South Brunswick Public Library. And I hope everyone enjoys their day and their first week of January.
Try to have a nice, peaceful new year. I'm sure everyone hopes that. But thank you. It was so
Bye,
nice meeting
guys.
you. All right. Thank you so much. Okay, take care.